Welcome to Talk 1260 KTRC. You're listening to The Humanity Behind the Vanity, a show about plastic surgery and other things. And today we have a very special guest, Dr. Maria Rodriguez, a gynecologist in Santa Fe. And we are going to talk about something I wanted to talk about for a long time. Dr. Rodriguez and I were doing a case together the other day, and this topic came up: vaginal rejuvenation.
She's the only one who does it.
In Santa Fe.
Yes.
And as a gynecologist, there is nobody better
Exactly.
to do it. And I get calls for this all the time, and I refer them out. So I'm so happy you're here. Welcome.
Thank you. Thank you, Daniel and Betsy, for having me.
We're so happy you're here.
I'm very excited about offering vaginal rejuvenation to the state of New Mexico. As far as I know at the moment, I am the only one in the state trained to do this procedure.
Yeah.
So, again, starting out in Santa Fe, I hope to expand even to Albuquerque at some point.
Great. Before we forget, how do people reach you? What is your phone number?
My phone number is 505-989-3870.
Where are you located?
At 1691 Galisteo. And I have a website. It's www.newmexicovaginoplasty. That's vaginoplasty.com.
Is it NM vaginoplasty?
Yes,
Okay.
NM. No, actually, it's New Mexico.
Oh, the whole thing's
Spelled
spelled
out,
out.
yeah.
Okay, good.
That's
Good.
great.
So, tell us, what is vaginoplasty?
Well, let's start out with the term vaginal rejuvenation. There have been many terms given to this type of surgery, and you know, the people who do this type of surgery still are trying to figure out what common words to use, but I think the word vaginal rejuvenation is what most of us are using at this point. And it encompasses various procedures. Probably the two most common procedures are vaginoplasty, which is tightening the vaginal canal, and labiaplasty, which is making the labia or the lips of the vagina trimmer or made smaller, depending on the patient's choice. And there are a few other areas that are done. One is called clitoral hood reduction for women who have a lot of excess tissue over the clitoris. Some people are doing something called a G-spot amplification to enhance the sensation in the area of the G-spot. So again, it depends on what the patient's needs are and you know, what procedures that she wants to have done.
Yeah. What is the most common one you do?
The vaginoplasty and the labiaplasty.
And a vaginoplasty is basically taking a large tunnel and just tightening it up and making it smaller.
Yes. And the idea, too, is really important to tighten the entire tunnel of the vagina. Some people claim to do vaginoplasty and they will only tighten the outer portion or the very entrance to the vagina.
Yeah.
And in order to really increase the friction for the woman during intercourse, you really have to tighten the entire vaginal canal.
And this happens, the canal gets enlarged because of childbirth, or women just made that way? I mean...
It's mainly through childbirth.
Okay. Interesting. And what about the labiaplasty?
The labiaplasty, again, gets very stretched out during childbirth. And, you know, after women are done having their children, some of them just feel really uncomfortable with the appearance of the vulva and want to have a more pleasing appearance. One thing I want to clarify is that a lot of people think that you might want to tighten the vagina for the male partner.
Right.
But in reality, it's really the women who tell me that they don't have as much sensation in the vagina during intercourse. And so they're really doing it for themselves. Now, it is a second benefit, you know, to have the partner enjoy this as well, but it really is primarily for the female.
Interesting, because you're right. The common thought is, oh, I'm going to do it for my husband, or men will like it, and no, it's for the women. So that's very enlightening.
Yeah. Where are the procedures performed?
In my office.
That's
yeah,
amazing.
these are done in
That's
my
great.
office with local anesthesia. We also do some cream on the labia an hour before
Right.
to decrease the sensation.
Right.
And they also take oral pain medication. So they're monitored throughout the procedure. Their vital signs are monitored, but I really don't need even to have an IV.
No.
Right, right. We've talked a lot about what's safe and not safe to do in the office, and there's a fine line between conscious sedation and doing procedures that don't require sedation, and that's the category that yours fall in, which is really convenient because the patients don't have to pay an OR and anesthesia fee.
Yes.
Exactly.
And is this something that is covered by insurance?
Generally not covered by insurance if it's being done for aesthetic reasons. If someone has a really unusual situation, a real asymmetry to the vaginal lips, sometimes you can get insurance coverage. In some cases, if the vaginal lips are very large, patients will be really uncomfortable sitting, and sometimes they'll even have pain in the area. And in those cases, you can get insurance coverage most of the time.
Right.
So so we didn't finish. Let's talk about the labiaplasty more.
Okay.
I mean, it gets stretched out from childbirth. It can also just be the way a woman has developed over time. Other than pain, are there any other personal reasons women might want to rejuvenate the lips?
A lot of it's appearance, cosmetic appearance is primarily the reason.
Okay.
It really improves their self-esteem.
Yeah.
And, this procedure is not for everyone, but there definitely are women out there who really feel that this procedure would help them.
Oh, absolutely.
Right.
What about the downtime for the whole procedure?
Well, actually, the procedure itself can take anywhere from 2 to 3 hours,
Okay.
but the downtime afterwards probably is about a week.
Oh.
There's a restriction on lifting, there's a restriction on when they can have intercourse, but in terms of going back to work, really probably within a week to 2 weeks.
Okay. All right, cool. Good.
Interesting. Here's a question. Just do you offer financing, patient financing?
Yes, we do.
Okay, excellent.
That's
Good,
huge.
good.
That makes a lot of difference.
That's very important.
And there's also a percentage off if patients pay in cash.
Sure.
Right.
But yes, we do have financing.
That's great. All right, just give the contact information right now before we take a break one more time.
Yes.
It's www.newmexicovaginalplasty.com,
All spelled out.
and the phone number is 505-989-3870.
And we're talking with Dr. Maria Rodriguez, a Santa Fe
Board certified gynecologist.
Absolutely. She's the only one in the state trained to do this. And
Yes.
we'll be right back.
And there may be
Oh.
other people. I just wanted to say we
Okay.
talk a lot about who's qualified to do procedures and who's not qualified.
She is
and
qualified.
This is the
100%.
right. This is
Who you should be going to.
This is who you should be going to.
Absolutely.
Wanted to thank our sponsors, Suniva Medical, excuse me, the makers of Artifil, and iFlow, the makers of the Pain Buster. And we're going to take a short break and listen to a great spiritual tip from Dr. Scott Thomas, and then we'll be right back to talk with Dr.
All right.
Maria Rodriguez some more.